यहाँ से बनाइए आप, सरकारी लोग किधर है?
Sound is okay?
Sir, audio check.
If you could introduce.
Last question. Should I introduce myself first?
No, sir. There's no need. We'll put in your
I think
graphics.
better. I can.
Okay, yeah, we can go with that. And then, अगर आपको prompts वहीं से देखने तो आप देख सकते हैं, वरना I can keep on. Yeah.
But you ask question and then I will.
आपको अगर वैसे करना है, that would be
better.
easier.
You ask question, I will.
Okay, then I'll just.
ऋषभ थोड़ा सा चेहरा हल्का सा, आप इधर मत आना।
इस तरह?
हाँ नहीं, आप ऐसे ही रखना, लेकिन इधर मत आना।
ठीक है।
कैमरा देखना
आप मुझे देखिए। So when I give you the question ना, अगर आप वापस से वो phrase last words repeat करके, like if I ask what do you recommend for preventive health?
वो क्वेश्चन को रिपीट करूँगा।
जी, तो आपके for preventive health screening?
थोड़ा जोर से बोलिएगा।
बिल्कुल।
You ready?
Ready? क्यों?
Ready.
ठीक।
So I am Professor Dr. Vivek Gupta. I am Senior Consultant Cardiologist in Apollo Hospital, Delhi. And tomorrow is
World Heart Day.
World Heart Day. Today बोलना है? पीछे बोलो। Today बोले या tomorrow बोले?
Tomorrow.
Repeat करो। कर दो उसको।
Yes.
Okay.
Ready.
I am
चलेगा देखिए।
I am Professor Dr. Vivek Gupta, Senior Interventional Cardiologist in Delhi Apollo Hospital. And tomorrow is a World Heart Day, which is 29th September. It is actually started for the purpose of creating awareness for the heart, so that we may not suffer from various heart diseases. And we all know that heart is the #1 killer of diseases.
Now we'll start with the questions. So, as you know, there is a lot of CVDs rising in the younger generation. Do you actually see such patients come in? Do you see a younger demographic and the change, not just elders, there are younger people also?
I have been practicing in Delhi Apollo Hospital for the last almost 28 years. And
ये बीच में आ गया?
नहीं, थोड़ा सा आप रखना।
अच्छा।
Yeah.
We'll just continue from there. So, do you see younger generation coming in?
तो जोश बोलिएगा।
So, do you see there is a rise in CVDs in the younger generation especially?
Absolutely true. Actually, I am practicing here in India for the last almost 25 years. Before that, I was working in France. When I joined here in 1998, 99, 2000, 2001, till 2005, we were seeing more of, in fact, before that also, when I was doing my MD Medicine and DM Cardiology, at that time we used to see that after age of 50 or 60 or 70, these were the population which was most affected by coronary artery disease. We are talking as of now of the coronary artery disease, which is one of the important killer. It encompasses three problems. One is stable angina, another is unstable angina, and third is most important, acute coronary syndrome or heart attack, which is acute myocardial infarction. These days we are witnessing for the last 10-15 years, and more so after COVID, that the patients of younger generation, maybe 25, 30, 35, 40, they are also getting affected without having any diabetes or high blood pressure also. So we are really concerned, and World Heart Day brings us to the platform like your TV channel, where we can discuss and see that how the patients or younger people can take preventive measures so that they don't fall prey to a major killer, and 50% of heart attack do not reach hospital. This is very important sort of a figure, that what we see in the hospital are those who survive initial. Otherwise, many patients die at home or on the way, or they die in the sleep. So it's actually a frightening condition. I don't want to make people to become panic, but of course we have to take prevention so that younger people should not be affected as much as we are facing today.
So would you say stress is the main cause, or the new lifestyle that we have been seeing? What is the main cause according to you?
Very important question, and we are sometimes intriguing ourselves, because mental stress, of course, overall has grown very fast. Because when you are starting developing to a developed country, for example, our Prime Minister Modi ji feel that we should become a good economy, then you have to work hard. When you are working hard, you have to have stress, because then you have a objectives and guidelines, and also a sort of a deadlines to do something. And as our country, which is 140 crore population, is having a maximum percentage of the younger population. So these younger population are under tremendous stress overall in India. Even those who are, I would say the people who are actually below poverty line, they are having much less stress. And what we are seeing today is that even the people who are below poverty line, they do not have that much of heart disease as compared to the middle class, socioeconomically, or a higher middle class or lower middle class. This is the most affected population because they are working hard for the country and they are under tremendous stress. The stress is as of now, we were talking diabetes, high blood pressure, cholesterol, smoking, tobacco as a major risk factors. Now two things have been added. One is mental stress. Another important thing is, of course, which is already being decided, is the strong family history. If anybody who has a father or mother or brother or sister or grandfather or grandmother suffering from any heart disease, they are more likely to fall prey to this precipitating factor of stress. And this stress can cause plaque rupture. This is, for example, the heart, and I have a diagram which I can show the coronary arteries. These are the arteries. I would like to explain to you, very important, that how the heart, what is heart attack? Heart attack is actually blockage of the coronary artery which leads to cessation of the blood supply completely for that particular time. So these are the small arteries, and I was showing here, this has gone. I was showing here on this TV screen. I'll just take 1 second to get it back. That how the coronary arteries behave. So these are the coronary arteries. If you can see in this diagram, the artery which is supplying the heart. Same thing is here. The red one you can see, if you can focus. These are the artery which is supplying the cardiac muscle. So heart is actually a pump which supplies blood to the whole of the body, including itself. So what happens is, when it starts contracting, the whole blood goes to various organs of the body, including this. So that is why the heart itself is so important, because if the heart stops, then the supply to the brain will be finished and the patient will die. But for its own functioning, heart is functioning all the time, while you're sleeping, ever since the fetus comes into the womb, till the time of death, heart is constantly working. Your heart is working, my heart is working, anybody who's there. So heart is beating all the time, and for its own beating, it supplies blood to itself. That supply to itself is the coronary artery. The blockage in the coronary artery, which is supplying blood to the myocardium, leads to heart attack. So these arteries are very small. These are only 3 millimeter diameter. 3 millimeter. The small arteries, if you have a cholesterol blockage, more than 70% the patient will have chest pain on walking. If this 70% becomes 100% because of the clot formation, there is a difference pathophysiology in angina as heart attack. In heart attack, the artery gets occluded completely within a matter of few minutes or few hours. That leads to the disturbance in the muscle supply to the muscle, and the heart can stop, and that leads to sudden death. If the heart survives, then the patient will continue to have pain, and then you have to go to the hospital to do angiography and angioplasty. I give you one more example. This is my hand. You can see in the camera. This is the artery which is supplying. You see the pulse? Pulse is the radial artery. This supplies blood to the hand, and there is another ulnar artery. So what I do, I am doing the compression so that this artery gets occluded for momentarily. And you see my hand is almost white. As soon as I release this, I will see the color changes to red. So this is what is happening in the supply of the heart, myocardium. If the artery gets totally occluded, then this area is actually white, and this causes pain. And sometimes the heart cannot tolerate this, it fibrillates and arrests it. That is why heart attack can lead to death because of arresting the functioning of the heart. But sometimes the heart is good enough and the blockage is not that proximal, then the heart will not fibrillate maybe for some time on ectopic activity, but still continue to contract. These patients reach hospital. And when we see the ECG is disturbed, and of course when we diagnose it, we take him to a cath lab, do angiography, open the blockages of this coronary artery, and then the patient survives. So 50% do not reach hospital, again treating only those 50% who are coming to the hospital. That is why it's a very deadly disease, and we have to be very, very careful.
Okay. So sir, what would you recommend for everyone in the population, including old and the young, for a preventive health screening?
This is the need of the hour, I would say. This is the need of the hour because the incidence and prevalence of coronary artery disease has gone up. And as I told, and you also told that many young people are getting, because of the mental stress or activity or or lack of sleep. Sleep is a very important factor. So the best way, I think, you have to have preventive health checks every 1 year, after age of 40 at least, or 35 or 30, those who are working. So every 1 year or every 2 years is more than enough. If you find something wrong, for example, if the patient detected with diabetes, strict control of diabetes. The patient is found to be overweight, you have to reduce your overweight. If the patient is found to be hypertensive, you have to start medicines. A lot of patients, they want to avoid medicines. That is not correct. If your cholesterol is high, you have to control your cholesterol. These are basic things. At the same time, I think a regular exercise to some extent, maybe 10-15 minutes. I don't want a rigorous exercise that you just go half an hour walking and drawing. That is not required. A body toning exercise and heart toning exercises will be good enough. 10 minutes in the morning, 10 minutes in the evening. If you don't have time in the morning, you do in the evening. If you don't have time in the evening, do in the morning. Irrespective of this, of course, but it has to be done. Empty stomach is better. Before food, before lunch or before dinner. Lunch time to working time hota before dinner. This is one thing. Secondly, sleep. Very important. Lot of people are not stressing about the sleep. They are actually depriving the sleep because they want to go for morning walk. That is absolutely rubbish. I would say you are killing your body. Sleep is the single most important immunity booster. Your immune cells, your regeneration of the body happens when you are sleeping. The whole body. And people are not sleeping enough, and that is why I would say 7 hours sleep. I would not say 5 hours. I would recommend try 7 ghante, whether we do it in the morning, afternoon, you take a nap. I don't think possible. For example, I take in the night only. But many people are very early riser and they can find some way out in the afternoon or something. So 6 to 7 hours sleep is very important to prevent any lifestyle related diseases. Then of course junk food. Youngsters are really so much is available outside that, and now it's available doorstep. You order on the phone and only on the phone you get to call them and everything is available. So I think what is harmful in junk food? Junk food is harmful because they have usually recycling of the oils. The same oil is recycled and that produces more of desaturated fats, and that is very harmful for cholesterol deposition in the arteries. So these things have to be taken care of. So I would say regular lifestyle, take food in time, good sleep, preventive health checks. If you have a family history, you have to be very careful. And one more thing I would like to add, that after age of 40, one should start, we cannot do angiography to every patient. Angiography is a test where you have to insert a catheter and you see everything on the screen. So angiography cannot be done for everybody. It's not recommended. It's only recommended for those patients who have angina. But if you have recommended angiography, lot of patients they try to avoid it, postpone it. अभी डाल दीजिए, दवा लिख दीजिए. इस तरह की thought process आता है. People feel if I do angiography, I will be undergoing bypass surgery or angioplasty. That is not true. But if you have angiography recommended, you should do it. Shortcut or little less invasive is CT coronary angiography. I would like to give you a you said preventive. So after age of 40, for example, anybody who reaches 30, 35, and very competitive lifestyle, hectic lifestyle, not able to sleep well, they should do CT coronary angiography, which is a dye, you insert a dye and then with the help of CT scan, without inserting the catheter, you will know that you have, whether you have some blockage or not. If you find 30% blockage, you can take preventive action. Because treadmill test, very important, I'm telling you. TMT, you know TMT? TMT is when you do the machine and do the ECG. ECG, TMT, echo will remain normal till you have a 70% block. That means somebody comes with a normal ECG, okay, TMT normal, okay, echo normal, okay, I'm healthy, You may be healthy because you still do not have reached that particular blockages level. Till the 70% blockage, all the things remain normal. Therefore, CT coronary angiography, which will detect 30-40% block, will be useful because if you have 40% blockage, you will have no pain, no angina, no symptom, you are still walking, running, everything, doing ECG normal, TMT normal, echo normal. But this plaque, 40% can rupture because of mental stress or lack of sleep or some hormonal changes, and that will lead to heart attack. You may have a normal echo, normal TMT one day before, and next day you can have heart attack. So this is something which is little tricky. So CT coronary angio, if it is normal, is perfectly fine. If you have some blockage, you start medicines so that it will not lead to serious heart attack.
Okay. And any social factors that you would like your patients to be aware of that can lead to a lot of stress, which in turn can lead to
Sorry.
social factors.
Social
family
factors.
stress.
I was taking recently a lecture for the MBBS entrance students. A lot of students who come. You see, the stress is more common among the people who are studying. In fact, if you see the 10th class student, 11th class student, 12th class student, 7th, 8th, 9th, too much of course. So these are social factors. So I think that parents should not push too much for getting a good position. Let him do on his own hard work. Even passing marks are more than enough. Everybody cannot top, number one. Secondly, social factors, of course, you see, if you see a lot of divorces happening and live-in relationship, and then people having changing and I don't know, and non-break up. So these are also social factors which can lead to heart attacks. And recently, I would like to stress upon the COVID. Actually, COVID has really precipitated young people getting heart attacks. And why it has happened? Because possibly the COVID, the spike protein. But the people who have been COVID patients should be completely aware of, should be more cautious, and they should do at least for health screening should be done, and they should also do CT coronary angiography. Avoid the inevitable, and something which is inevitable you can't, you have to ignore it. Something, for example, if you have I cannot give you a good example, but something which is inevitable, you have to. I think that story will be too long. If you want, I can tell the story. Should I tell the story?
It's about your time.
Yeah, so there was a story which is very interesting. There was a person who was always praying to God, give me something, give me something, give me. God comes to him, and God says, what do you want? He said, I will give you whatever you want, but I have a. This is a story which will tell you that you have to be changed. This requires a lot of efforts. That means your peer getting happiness. Your peer getting happiness should bring happiness to you also. The story is for that purpose. So God comes to him. He said, "What do you want?" He said, "But I will have to tell you that I have one system that I will do. I will give something to you, but the same thing will be double to your neighbor or people around you. For example, if I give you one car, they will get 2 cars. So you ask whatever he said. He said, okay, I'll ask, okay, give me 1 home. Okay. He gets a good home, but all the people get 2 homes. Not happy. I'm talking about happiness. He's asked for 1 car and everybody gets 2 cars and he has only 1 car. He asked for 1 lakh rupees. 1 lakh rupees comes to him, but the rest of the people get 2 lakhs. He said, I will give the double of what I will give to you, but I will give you everything what you want. He's so confused. He has got 1 house, other people have 2 houses, because he's not happy because he feels that he has to be superior to his own. You have to feel happy with the other people's happiness. So finally he goes to his lawyer. He said, what to do? God is giving me double to everybody. I'm not still happy. Usko na de, humko de de to khush ho jayega. He said, that lawyer was very cunning. He said, you ask God to create a well outside your house. One way. Without any, what is that known as? Fence. So he said, we asked 1 well outside the house, but the rest of the people have 2 wells without. Now that lawyer said, what to do? He said, you ask the God to finish off 1 of your eye. Aag phod de, ek aapki. So you will be single eye. The rest of them, all of them will be totally blind. So this is how the people feel. Okay, he asked that. He asked, okay, I want to be 1 eye, don't do 1 eye. Rest will be without eye. So they all start falling into that well. And now that makes him happiness. So this is what you have to learn, that you have to feel happy. At least don't feel unhappy with somebody is happier. तो अगर आपको खुश रहना है तो दूसरा भी खुश रहना है तो उससे भी खुश रखिए. कहने मतलब है आपको खुश रहने के लिए जरूरी नहीं है दूसरा दुखी हो. For keep yourself happy, but don't be jealous of your neighbors. So this is a very important story which I've told you.
Amazing, sir. Just to end with, would you recommend your patients to go ahead with meditation, yoga, or such,
Meditations are important actually. I take 3 pills without being having anything because I want to prevent it. So preventing medicines are important. Yoga is a good body, it's a body routine. What is yoga? Yoga, you have to be doing something, movements of the body that really helps. And then meditation is a different art which I have never practiced myself. But if you have time, then you can meditate. To that extent, that will give you some sort of a mental peace. It is only to require the peace. So be happy, don't be jealous, don't be, never speak lies, झूठ बोलने. जहाँ झूठ बोलेंगे वहाँ पे आपको टेंशन शुरू हो जाएगा, झूठ पकड़ा ना जाए. But if you're truthful that you are okay, then you will be very happy. So prevention of heart disease is simple, and one has to really follow a good lifestyle and good sleep, and without mental stress, which is not easy. So I told you that if you want to be, if you just forget कि मुझे जो मिल गया ठीक है, have patience. Patience is very important. If you do have good patience, God will give you something, but God will not give you everything. God will give you what you deserve, but it may come a little late. So don't be impatient to get everything the same day. So everybody cannot be so. I always feel that the top people in the world, if you